Hey everyone, welcome back to the Performance Pathways channel. We are currently on the road to 1,000 subscribers. So if you could like this video, subscribe to the channel, it'll really help the channel grow and you won't miss any future content that comes out down the road. Today we're going to be talking about pain in the hip during squatting activities. So whether it's back squats or front squats, everything we do will still apply today. So with that being said, let's dive into this. When it comes to hip pain during squatting, you can have pain in the front of the hip, you can have it out on the side, sometimes it even wraps around down to like the tailbone area. These are three very different conditions, but they all generally have the same root cause. You're just getting pain presenting in different areas. A lot of times this pain in the front of the hip, people think, oh, I have a labral tear, I'm having impingement, which those are things that can be can be present if you were to get some form of imaging. But more often than not, the imaging is not appropriate. You don't need it. You just need to do some mobility work and some targeted accessories to bolster that hip up, improve your mobility, improve your stability, and that pain will melt away. This isn't something that always requires surgery. When it comes to the impingement in the front of the hip, I like to describe that as more of a scenario rather than something structural. Usually people have a mobility limitation at the hip, or they have some kind of strength deficit at the hip, so they don't have a mobile and stable hip, or some combination of the two. The pain on the outside of the hip, that's typically a gluteal tendinopathy, again, very easily treated by mobilizing and strengthening the hip in a specific way. A lot of times this pain that's kind of like in the back on the tailbone, people will say it's SI joint dysfunction. Again, more often than not, this is going to be fixed by addressing these impairments of a lack of mobility or a lack of strength in these muscles and joints surrounding the hip joint. So with that being said, we're going to go through some of my go-to mobilizations and then a few accessory exercises so that you can start improving your squat and get back to training pain-free in the gym. So let's dive into it. This first mobilization we're going to cover is my go-to for anybody that has limitations in external rotation and internal rotation of the hip. What we're going to do is get a kettlebell. You can put a pad on the ground. We're going to start with a knee on the ground. I'm have you start in this position. I want you to pick a wall that you're facing, and you're going to keep your chest squared to that wall the entire time. So once you get in this position, you're going to kind of walk that hip out as far as you can go, making sure that your hip, knee, and foot are all in a straight line. I don't want your knee collapsed inward for this mobilization. We also want to make sure that we're not turning our body with it. So basically walk that foot out as far as you can without the knee collapsing and without your chest turning towards your leg. Once you get to that position, you're just going to pick up a little bit of a light kettlebell, and then from here, all we're going to do is drive that knee out over our toe. You want to keep your chest really tall with this. If you let your chest come forward, you're going to lose the stretch. But all we're going to do is drive that knee out over the toe, hold for about 3 to 5 seconds, and then back off. You can perform this 10 times on each leg prior to your squat day or your leg day as part of your warm-up. This next mobilization is the pigeon stretch. I like to do this on a bench or a box. We'll make some modifications to this depending on what you're feeling during the stretch. So if you have access to an incline bench, that will give you more freedom to modify the stretch, and I will show you what I mean by that as we get rolling here. Basically what I want you to do is take your leg, and we want to try to make sure that the entire shin bone has contact with the bench, and then you're going to keep your torso really tall and try to let your hip sink towards the floor. You can hold that stretch for about 10 to 15 seconds and then back off of it. If having the bench completely flat is too much, maybe you're feeling a little bit of torque on the outside of the knee, this is where having the incline bench comes into play. You can slightly raise the elevation of the bench, and then from here, you can get a little bit more support and still achieve that desired stretch with a little less of that torque on the knee. Big thing here is just making sure that you keep your torso upright. You may need to scoot your back foot further away from you as you let your hip sink towards the floor. Again, you can play around with how much of this incline you need, but we basically want to be able to find a stretch that is comfortable that you can hold for about 10 to 15 seconds. Repeat this stretch maybe up to 5 times as part of your warm-up prior to any kind of squatting. This is going to help open that hip up and take away a lot of that unnecessary stress and strain during your squat activities. When it comes to accessory strengthening, I hardly ever prescribe exercises that are in this like sagittal plane, meaning the movement is straight up and down or front to back. Nearly all of my accessories that I prescribe are some kind of side to side or rotational variation of an exercise. If you think about your current programming, I would venture to say nearly all of it is done in this sagittal plane, meaning you're moving a weight front to back or you're moving a weight up and down. Adding in these accessories that are maybe in a side to side or rotational plane is a great way to help bolster your hip and create a lot of stability. This is an exercise I like to do. You can use it as a warm-up and then also circle back to it during a workout and finish it off at a higher intensity for some accessory work. But what we're going to do here is a little bit of an elevated lateral lunge. So you can play around with the amount of elevation. I've just got a 45-pound bumper plate on the floor here. What we're going to do is get a kettlebell or a dumbbell, and then you're going to hold the dumbbell in front of your chest or whatever's comfortable for you. But basically what I want to see is as we hinge to the side, our chest is going to come forward a little bit and our knee is going over our toe. So we're just performing this kind of stationary lateral lunge. The emphasis is this push off here. I want you to think about pushing out in a way to help drive yourself back. You should feel this on the outside of the hip. If you feel, something on the in the groin area, you're likely just feeling a stretch because of the amount of pre-positioning. That's okay too. But basically, make sure that your chest hinges a little bit. I don't want you to keep your chest vertical and drive that knee over the toe. That's going to load the quad a lot. We're trying to target the hip here, so we need to hinge a little bit. So again, just making sure that as you go to the side, your chest is going to come forward as you go out to the side. Try a couple sets, 10 to 12 reps as part of your warm-up, and then if you want to, circle back to it later in your workout and do 3 to 4 sets at a little bit higher of an intensity. You can drop the rep range if you want. This last thing I want to talk about is the squat itself. So whether it's a front squat or a back squat, there are some key points we want to ensure are happening during our squat. This first thing that I want you to think about is the center of pressure in your foot. So where do you feel most of the weight in your foot during your squat? If you feel your weight drifting into your toes or if you feel it drifting into your heels, I want you to find more of a middle ground, maybe slightly behind the ball of your foot. It should feel very centered throughout the squat. This is going to ensure that your squat mechanics are appropriate and you're getting a sufficient amount of hip hinge relative to the amount of knee bend that you have during your squat. We also want to play around with stance width. So there's no one size fits all stance width for everybody. Everybody's got different body dimensions. If somebody is experiencing that pain on the outside of the hip when they're squatting, the first thing that I do is just have them slightly widen their stance. It doesn't have to be a crazy wide stance. We also have a little bit of out toeing, so turning your toes outwards. This is going to help open the hips up during the squat and encourage a pathway where your knees travel over the toes and they also travel away from you a little bit. So as you squat down, we should see a little bit of opening in the hip. We should feel very balanced in the center of our foot, maybe slightly behind the ball of the foot. We're not shifting our weight into our heels or way out into our toes. So again, warm up with the barbell, really get a feel for where that center of pressure is in your foot and try to maintain that through that entire squat range. We want to, again, encourage a little bit of opening of the hips. This is creating internal rotation of the hips as your knees go away. Your pelvis is moving on a fixed femur. So driving the knees out is going to open up the amount of internal rotation that you can dive into during your squat. Thanks for watching this video. Again, if you're liking this kind of content, like and subscribe to the channel so you don't miss anything in the future and help us out on our road to 1,000 subscribers. If you are ready to take the next step and schedule your free performance pathways assessment, click the link in the comments below and fill out the form, and then I'll reach out to you and we can schedule your performance pathways assessment. Again, if you don't live in the area, totally fine. We can do this over Zoom, but until next time, I'll see you then.